Well, I'm absolutely delighted now to be joined by Dr. David Penson, who is the AUA Health Policy Chair. Dr. Penson, welcome.
Thank you very much.
Thank you for taking time to talk to us on your busy day.
Thank you. It's good to be here.
So when you came to put the agenda for this year's meeting together, what were some of your main objectives?
Well, always with health policy, what we want to do is we want to keep our members informed, let them know what is cutting edge, what's coming down the pike, and importantly, help them to understand the issues so they can deal with them in their daily practice. So when we put together this year's meeting, we really wanted to hit some high points. There's been a lot of discussion about how we do prostate biopsies as an example, how insurers pay for it, what's the right way to do it scientifically so we can justify the way we do our coding and our billing. So that was one of our key focuses. Other things we wanted to do is we wanted to make sure we have so many new great guidelines that have come out at this meeting. We wanted to make sure that they got adequately spotlighted. Hopefully that way members will be able to go home and take what they've learned at this meeting and put it right into their practice and help patients, and also make sure they're able to keep their practices up and running.
Now, you talked a little bit about spotting major things that are coming along, and obviously at the moment you're busy with two major issues coming out of Washington, the sequester and the Affordable Care Act. If we look at the Affordable Care Act first of all, what kind of impact is that having on AUA members?
Well, so it's starting out slow right now, and that's the way the law was written. In fact, most of what's happened so far has actually helped our members because we've seen more patients have insurance coverage, and so it's increased access. But what we're going to see over the next 5 to 10 years is going to be difficult for members, because what's going to happen is, number one, we have a tremendous workforce shortage among American urologists, and we're going to see more patients coming in. So this workforce shortage is going to become particularly more pronounced. So we're very concerned about that. The way we get paid is going to change. I think we're going to see a movement away from the fee-for-service model and more towards getting paid for value, ensuring that we have good outcomes, potentially even getting paid on a capitated basis. I know a lot of members are going to look at that and say that's bad news, but I would say before you completely dismiss it, remember that if you're proactive and you think carefully about it, it may end up being a blessing for you, make your life easier, make it easier for you to practice medicine and urology, both from a financial standpoint and from a general quality of life standpoint.
But the other issue we talked about was the sequester, which I don't imagine is making life easier for your members at all, but what effect is that having?
Well, you know, the sequester is a funny thing because it's affecting, well, it's really not very funny, frankly, but it's affecting a number of different areas throughout American life. Within healthcare, it's resulted in a 2% cut in Medicare billings. That's across everything. So physicians are getting paid less than 2% less. Now that may not seem like a lot on the surface, but what you have to realize is it hits you in unexpected ways. So I'll give you an example. For urologists who have medications in their office, Part B medications, that 2% is actually more than one might think, because none of it is borne by the patient. So what it does is it reduces the margin, and that's really, you know, before we were only getting a 6% margin on average sale price, it reduces it to 4%. So really, it's making it even tougher to make ends meet in that one area. And for hospitals, they're feeling it much worse than physicians. So it's funny, on the surface, sequester you wouldn't think is going to hit you too bad, but for some docs, it's really hitting them hard.
Well, thank you very much indeed for talking to us today. It's been fascinating, and I hope you have a great conference.
Thank you so much.